Hyperthermia is a type of cancer treatment that uses heat to kill cancer cells. It's not a new idea. Doctors have known for centuries that heat can shrink tumors. What's new is our ability to target and control the heat, making it a powerful tool in the fight against cancer. Hyperthermia works by raising the temperature of tumors to a level that damages or destroys cancer cells. This heat therapy can be used alone, but it is most often used alongside other cancer treatments like radiation and chemotherapy. When combined, hyperthermia can make these treatments more effective. Think of it like this. Imagine trying to weaken a fortress. You could attack it head-on with your strongest weapons, chemotherapy and radiation. Or you could try to weaken the fortress walls first with hyperthermia, making your initial attack even more effective. Hyperthermia isn't right for every cancer patient or every type of cancer, but for many, it offers a ray of hope in their battle against this complex disease. Cancer cells are different from healthy cells in many ways. One key difference is their ability to handle heat. Cancer cells are more sensitive to heat than healthy cells. This makes them vulnerable to hyperthermia treatment. When heat is applied to a tumor, several things happen. First, the heat directly damages the cancer cell's DNA, making it harder for them to grow and multiply. Second, hyperthermia can cut off the tumor's blood supply. This deprives the cancer cells of oxygen and nutrients, leading to cell death. But hyperthermia's benefits go beyond direct cell kill. Heat can also make cancer cells more sensitive to radiation and chemotherapy. This means doctors can sometimes use lower doses of these treatments, potentially reducing side effects. Think of it as a 1-2 punch. Hyperthermia weakens the cancer cells, and then radiation or chemotherapy delivers the knockout blow. This combined approach can lead to better treatment outcomes for certain cancers. There are different ways to deliver heat to a tumor. The method used depends on the size, location, and type of cancer. Let's look at the three main types of hyperthermia. First, local hyperthermia targets a specific, small area, like a single tumor. Doctors use various tools for this, such as ultrasound or microwaves. Next, regional hyperthermia heats a larger area, like an entire organ or limb. It's often used for cancers that have spread regionally. One technique involves circulating heated fluids through the affected area. Lastly, whole-body hyperthermia raises the body's overall temperature. It's a more complex procedure used for cancers that have spread widely. Patients are carefully monitored in a controlled environment. Each type of hyperthermia has its advantages and challenges. The choice depends on the individual patient and their specific cancer. Hyperthermia is rarely used as a standalone treatment. It's most effective when combined with other cancer therapies like surgery, radiation, or chemotherapy. Let's see how this combination works. With surgery, hyperthermia can make the operation more effective by shrinking tumors before the procedure, making it easier to remove the entire tumor. With radiation, heat makes cancer cells more sensitive, so combining these therapies can lead to better tumor control and potentially reduce the required radiation dose. When it comes to chemotherapy, hyperthermia can enhance the effects of some chemotherapy drugs, making them more potent against cancer cells. It's important to remember that hyperthermia is a complex treatment. It requires specialized equipment and expertise, and not all hospitals offer this therapy. If you're considering hyperthermia, talk to your doctor to see if it's right for you.